Hello and welcome everyone to our first session of career counseling series. I have with me a very dear friend and an excellent transplant anesthetist, Dr. Susan Paulin, who is working at Rela Institute in Chennai as a consultant liver transplant anesthetist. Thank you, Dr. Susan, for gracing this video and helping our students out.
Hi, Jhanvi. Thank you so much. That was a very kind introduction. And yeah, actually, I should thank you all for giving me this platform to share my passion, which is liver transplant anesthesia. And I hope I'll be able to help few people, at least few, in making a good or certain career choices in their lives. Yeah, I'm too excited for this. Yeah, let's see.
That's great. So, let me give you a little bit of background about Dr. Susan. And in fact, we were co residents from Tata Memorial Hospital. And after finishing our PG, we went on different pathways. I preferred to do regional anesthesia, and Dr. Susan decided to do transplant anesthesia. So, Susan, can you tell us what triggered your decision of taking up transplant?
So I hope, Janu, you remember, like even during our final year of MD, I was just going on yapping about doing transplant fellowship. I was just asking all of our consultants about it. And one of my main motivation for it was our hepatobiliary background from Tata Memorial. So I was too fascinated by the interesting things that an anesthetist can do, which will have a huge impact on the outcomes of the patient during the intraoperative period, especially during in hepatobiliary surgeries. So that was one of my main motivations, and I felt that I needed the graduation which you can get as a perioperative physician. You see,
Hmm.
we need to optimize the patients preoperatively, then intraoperatively your patient is entirely in your hands, and postoperatively also I wanted to follow my patients and make sure they go out of the ICU well. So I felt that I needed that gratification personally, as a perioperative physician, and I felt that transplant would give me an opportunity to do that. So in fact, we had zero exposure to transplant at that point, and it was a relatively new field and very we did not even encounter. We had Dr. Sohan with us, following a fellowship in HBB and liver transplant. But apart from that, we didn't have any mentors or people who had experience in this background. So I wanted to see how it is, firsthand, on a first-hand basis, make an informed decision before going into this. And of course, I faced multiple remarks. Some people said that it is not a perfect field for a female to do, female anesthetist, and many felt that I would be stuck in the theater most of my days, and my work-life balance would be off the chart. Most of it is true, but of course, I like being in liver transplant anesthetist, and I think that pays for it. Yeah.
Okay. So, Susan, after you finished your residency, can you tell us how you found out what are the avenues to train in transplant anesthesia? And can you throw some light on what are the fellowships, or is there any DM available, how to apply for all of these?
Yeah, so I started looking for fellowships 6 months before I was going to finish. So from what I heard from multiple sources, that the waiting list is on, it's is long, and we don't have a lot of centers which offer fellowships and DM. So you had to apply to the hospitals, take their interviews, and then wait for them to get back to you. So this was a scenario almost 5 years back, and I had to wait almost some 8 months after I finished my MD to get into the fellowship program. And I chose Rela Institute as my place, because I felt that it's a high volume center, and I wanted to get into Rela Institute by any chance, by any means. So I was patiently waiting for my chance to get into the hospital. But this was also associated with my lack of knowledge about the programs elsewhere. And this was in my hometown. But I mean, I belong to the south side of the country, so I wanted to go back to my hometown. So I preferred hospitals in the south. But later on, I came to know that there are multiple centers in the north, especially in Delhi, and most of which offer fellowship programs, 1 year or 2 year long. And there are a couple of hospitals which even offer DM programs, DM in solid organ transplant anesthesia and intensive care. So they don't just concentrate on liver, but also in kidney and even pancreas and small intestine. So this is available in ILBS and also in Mahatma Gandhi, if I'm not wrong. So they have a DM program there. But fellowship programs are in multiple hospitals. There is in Medanta, there is in Max Super Specialty, Saket, and there is in SGPGI, Chandigarh. And in the south, you have in Amrita, Kochi, and of course in our hospital also. So yeah, a lot of hospitals are coming up with programs, but you need to choose which one. Even Aster in Kochi, Kerala has a program, fellowship program. So the intakes are usually limited to 1 to 2 seats, and some hospitals do take every 6 months or once in a year. So we have a society in India, the Liver Transplant Society of India. So they offer fellowship programs. I think they do 2 to 3 seats per year. So you have to apply in their website and then go through their interview process and then choose your hospital of choice. And then as per the hospital availability, you will get the fellowship program. Yes, yeah.
Okay. So basically, the whoever wants to go for transplant anesthesia should start thinking of it in their final year itself and
Exactly,
start
because
applying
now that
immediately.
DM has come, you need to apply through the NEET super specialty exams. So you need to take that exam and then wait for the intake. So we in Rela Institute we have started FNP programs also now.
Okay.
So again, the intake will be through the NEET super specialty exams.
Oh, okay. All right.
Yeah.
Now, can you tell us a typical day in your life as a transplant anesthetist? I want it to be divided into two sections. One is when you were a fellow, and what
Mhm.
were your roles and responsibilities, and what is the difference now that you're a consultant?
Okay, sure. Um, we at Rela Institute, what we do is we do a bit of liver medical, not a bit. We manage the liver medical ICU, which is the medical ICU for the cirrhotic patients, and we do the anesthesia part, and then post transplant ICU is also under our care. So we have multiple consultants in the team and a lot of fellows. So we will each have our rotation in the ICU and in the theaters. So when you have the ICU month, we will be rotating between the medical ICUs and the transplant ICUs. And during our OT rotation, we will be in the theaters. So we do the donors, the donor hepatectomy. So most of it is a living donor program, where the a related donor relative will donate a portion of their liver. So we will start the donor surgery by around 6ish in the morning. So this is a standard time across many hospitals. Some hospitals where they don't have enough manpower, they will usually start it way earlier, say 3 or 4 o'clock in the morning. So the donor anesthetist will have to come quite early and start the donor surgery. And then the donor surgery, halfway through the donor surgery, we will start the recipient surgery. So usually there will be two anesthetists if you are luxurious enough to have one. And in some hospitals you don't have the luxury of a qualified transplant anesthetist available. So the donor anesthetist usually finishes that case. Even the donor surgeon will finish that case, and then they will start the recipient surgeon. So in many centers, I've heard the surgery going on, the donor plus the recipient going on, even up to some 24 hours, exhausting the team. But when you have the luxury of a big team, you don't have to be too worried about this, because you will have a donor anesthetist and a surgeon, and you have a transplant anesthetist and a surgeon. So they will go on hand in hand, and we can look at around 6 hours of donor surgery and 12 to 16 hours max of a recipient surgery. Yeah. So as a fellow, pretty much the same actually. So just that the consultant needs to take the entire ICU round. Then we will have a combined meeting with the hepatologist and the transplant surgeons to make decisions for all the patients. And then we will have to do a counseling for the patients attenders regarding the clinical status, and then pretty much keep doing rounds and then troubleshoot here and there for the ICU patients. And in the theater, always there will be a consultant plus a fellow. The fellows will be doing inpatient rounds, and they will do the bedside assessments, and they will come back to the consultant, and then they will take their opinions. They can give their suggestions. Then we can all make a combined decision regarding patient management. And the same goes in the theater also. The fellow and the consultant, they work together and then make clinical decisions and then assessments, and then carry on like that.
So your typical working hours in the ICU would be how many, and in the
So
OT
the
would
ICU would be fixed. So we will come by around 8ish in the morning, and then hand over to the night team by around 5 to 6 in the evening. But for the theaters, it will depend upon when the theater gets done.
Okay.
So that cannot be fixed.
It can range anywhere from.
That's what. So for a transplant case would be between 12 to 16 hours. And pediatric transplants get done earlier, maybe even 6 to 8 hours. But the adult recipients will take a little longer.
Okay. So as in transplant anesthetist, do you have calls? And what do you want calls
So
exactly?
yeah, we do have calls at our center, because we need to manage the transplant ICUs, and then you even have emergency cases, re-explorations, and things like that. So on our on-call days, we will be managing the ICUs. So the night on-call starts by around 5 o'clock and then goes on till the next day around 8ish and 9, when we hand over to the morning team. And during the on-call hours, we will be managing both the ICUs and then do any re-explorations or emergency cases as required related to hepatobiliary actually. So not
Okay.
just the transplant, the fellowships usually include hepatobiliary anesthesia actually. So you have Whipples, you have hepatectomies, and you have pancreatectomy. So things related to the HPB part. So anything related to this, we will be attending to that.
Okay. All right. So what is the journey to becoming a consultant in transplant anesthesia? Does it take too many years to become a consultant? Is the field saturated enough already? Are there not enough spots, or there is a lot of space for everyone to grow?
There is a place for a lot of people to grow, but the thing is, it is a field where you will evolve only with the years. Just after one fellowship, you cannot become somebody who can be well versed in transplant anesthesia, because this is a very complicated field. So all will look nice and smooth, but when a crisis happens, only when a crisis happens, you will know, you will find out your true potential of how you are going to get out of the situation. And only with experiences and years, you will be able to know how to tackle each and every complication that comes from this. So I would say the intraoperative part can be managed somehow, but the post-transplant part requires a lot of years of knowledge and experience to manage well and have a good outcome. So that is where the challenge happens. So in many places, across the country, people practice mobile transplant anesthesia. Then you have a couple of anesthetists, okay, they will go to different places, they operate there, they hand over to the in-house intensivist, and then they will go back. So many people practice like this. It's about your choice, actually. You can even practice like that. But if you want to take care of the post-transplant part, I would say that requires a lot of years of experience and knowledge, and an ICU background will be very, very useful in this scenario, actually.
Okay. Two important questions when we get out of residency. Is transplant anesthesia financially rewarding? And second is, how is the work-life balance?
Of course, it is financially rewarding because you do get a few bucks extra than your other counterparts. But I would say that they would make you work like anything for that few extra bucks that you get. But it is, I would say that it is about your personal satisfaction. So this gives me a personal job satisfaction, so I am putting up with it. But I would say the work-life balance is actually not that great, because the living donor transplants are very okay. I would say they are in a fixed hours. You will know when they are going to start the case. You can plan your day according to that. But when it comes to the disease donation, that is where the challenge is. So you should be ready to, drop everything, at your house, and be able to go ahead even to a different town or city to get the organ, and then even do a transplant there, stay with the patient for a couple of days, and then come back after you stabilize the patient. And even if something happens during the next few days, you will have to be ready to go back again, then do whatever is required, even take the patient up for a resurgery, and then come back home. So this is the very challenging part, which I'm still trying to come to terms with, because I have a small kid, and it's very difficult for me to manage this. And thank you, it is actually thanks to my team who try to help me out with such situations. But I wouldn't say that that luxury will be there everywhere in many hospitals, because many of the hospitals usually run with one or two transplant anesthetists, and they have strong DDLT programs, and they rely only on DDLT. So in such situations, the anesthetist will have to be ready to put their family commitments, social commitments on hold, and be available for the cases, because it might happen once in 1 or 2 months, and you cannot just say that you are not available for the case. It's not just to liver transplant, even to any other transplant, kidneys or even heart, lung. The DDLT would be, the disease donation would be very, very challenging for the anesthetist. That is why many people don't prefer this, because of the one is because of the prolonged hours, and next is because of the unpredictable nature of this work. Yeah.
Okay. Can you throw some light on, is there any career abroad after training as a transplant anesthetist in India, and which countries?
So many of our consultants have trained abroad. I had the opportunity to meet many of the specialists from abroad a couple of times during conferences and meetings. And especially the King's College in London has a lot of fellowship programs available, and for liver. And even in Canada, Toronto has some programs for even for lung transplants. So many of my colleagues and consultants have trained from there, and they feel that the programs are rewarding. A couple of years there, and you get to see how they do things differently. I would say that India has almost come to their standards, actually. Our standards and our ICUs, our equipments have all advanced as well. So most of our consultants, our teachers have trained abroad, they have done their FRCS, so they are able to inculcate their principles to us also. So yeah, so if you would like to go and see how they do things, it's always a better thing to go and see firsthand. or learn from our teachers here. But yeah, deceased donation would be the thing that you will be learning there, because they do that only. Only in India we do living donor program. So yeah.
What about training here and moving abroad? Do they actually take people who have trained in transplant in India, and are there openings, like especially in Middle Eastern countries, they do take a lot of anesthetists. So is there any option of moving
So
abroad
the
after?
pathway is going to be the same as a a normal anesthetist. So nothing special recognition will be given for your Indian degrees, because most of these degrees are like your deemed university recognized or your hospital recognized degrees. They are not even recognized in the entire country. So so that would be the downside of it. Your degree would be an additional benefit there, but just if you have an FRC or an EDAC, that would be the best thing, along with an Indian transplant degree would give you some extra brownie points. But the pathway is going to be just the same. They would expect especially the Middle East would expect the a UK degree or an European degree, and then your Indian degrees would be given some special considerations.
Okay. Last question before we wind up. Any advantages, like what are the advantages and disadvantages of being a transplant anesthetist? Do you feel coming back you should have done something else, or do you feel like I'm missing out on general anesthesia? And also the advantages of being specifically in one field, and what is your message to everyone?
So I had been practicing exclusive transplant anesthesia in the past 4 years. So I feel like I have forgotten most of my general anesthesia, actually, the especially the procedures. But I'm sure I will be able to get them back.
Get back.
Yeah,
Yeah.
if I try. So I'm not too specifically worried about that. But I feel that I still have a lot to learn in transplant anesthesia. A lot of my confidence comes by the presence of my seniors and mentors in the theaters, and each case is different. Actually, you can never be like too confident that you will be able to get through the cases smoothly, because anytime anything can happen, and that is where your strength lies. You should be able to make quick decisions, use your clinical knowledge to your best ability, use your resources, your human resources, your mission resources to make the best use and make quick diagnoses, and then save yourself and the patient from tricky situations. So yeah, so that gives me a bit of challenge. So I find that challenge rewarding, actually. So I would feel that, but I cannot speak for everybody, but I feel that these challenges keep me going. Actually, I see many people feel that it is going to be monotonous. You are just doing transplant a day in and out, so it's going to be very monotonous for you. Even some people say that this has become like hernia surgeries in the the LDLT, the living donor transplants are becoming like hernia surgeries for you guys, because of the monotonous situation. But I personally, I don't think that is right, because every case is different. Things can change rapidly, things can go downhill rapidly, and you do need a lot of learning, a lot of experiences, and to keep moving forward and do well in your cases. So there is a lot of learning to do, and this is a very challenging situation. Not just liver, any transplant for that scenario. I find heart and lung more intriguing and challenging, and it's more strenuous on the anesthetist as well. And again, as a lady, I feel it's going to give me a little of trouble at home, and you need a good support system. In fact, you need people to be understanding of your situation, of your passion, of your career goals, to support you, especially the spouse and parents and your children, of course. So a lot of things need to be taken into consideration before stepping into this. So many people people say that they want to do the fellowship and then get on with their lives, but I feel that why would you go through a vigorous fellowship if you're not going to practice it? Because only with practice you're going to become a good anesthetist in this field. So you can't just do it for a year and then forget all about it and then just get on with your life. So that is not going to be of any use. You need to be in the field, seeing things, learning things every day to become to make it useful for you and for patients actually. So yeah, that I wouldn't suggest that, just going into it just for the sake of the money, just so that you can apply somewhere and say that I have this fellowship, so I need extra bugs, and then where in a place where you won't be able to make it of any use. So yeah, have a lot of consideration before jumping into this.
Top three qualities for being a good transplant anesthetist. Just three.
I would put patience on all three actually. You need a lot of patience to put up with a lot of things. And yeah, so your qualities would be patience, good thinking, and keep learning. Yeah, you need to be open to learning. You cannot just say that now that I finished fellowship, I know everything. So that attitude should never be there. Be ready to learn, be ready to accept that you need a lot of learning, and be patient, because your surgery is going to be very long. Be patient with your surgeon, be patient with your nurses. Even the nursing team needs to be robust to help you. Otherwise they are going to make your life miserable. If they are not trained in this field, they are not going to understand. You need to prepare so many infusions. You need to make sure those infusions are in the correct concentrations, they are going in the right way. There are a lot of things to be taken care of. Asepsis needs to be taught to the nursing team. So everybody's input comes into play. So you need to patiently prepare your team if you are planning to start a program after a fellowship actually. So patience, quick thinking, and keep learning. Yeah, that would be my advice and qualities. Yeah.
Okay. Thank you so much, Susan, for joining us today. I think this really gives a good insight because transplant is not one of those historical fields in anesthesia which people have been doing like cardiac or neuro. It's actually upcoming in the last 10-15 years.
Yeah.
And if our readers have any comments or if they want to ask us any questions, they can leave the comments in the chat box. And both of us or either of us will come and address them. Thank you so much, Susan, for joining us today.
Thank you, Jhanvi. Thank you so much for having me, and it's been a pleasure chatting with you and sharing my views on this. I hope it will be helpful for few of you. So I'm looking forward to the comment section. Yeah. Great.
Also, Dr. Susan has been taking our lectures on transplant anesthesia as well as intraop management for hepatobiliary surgeries, including the physiology. So you can subscribe to the platform and you can watch her amazing lectures. Thank you.
Thank you. Thank you so much. Bye.